Hello, everyone. Good evening, and welcome to ATP Live Monday. It's my pleasure to be here today. So, welcome, whichever platform you're watching from, on Instagram, on Facebook, on our YouTube channel. I just want to say welcome, everyone. I'm going to just share the link so that other people can see us and join us. I just want to make sure my volume is just appropriate. Okay. I hope we've all had a very lovely day. Welcome, welcome, welcome. So just change this. And you can also help us invite friends, share the links so let them join us as well. So anyone who may have any questions about the health of your children, we welcome them to join us now. Atp Live Monday. Okay, I'm trying to look for the video. Okay, sometimes the video is not available. Okay. Welcome, everyone. I'm just trying to share the video to our group so that people can see. So I'm just doing that right now. But if you have any question, you can start to drop your questions straight away. Okay, I think I've shared it. Just need to pin them. Okay, my stories. Okay. Let me just do the pinning, then we can start. Just give me a minute. Just to pin the video. Okay, yeah, I think I can see. Um, okay. All right. So again, welcome everyone. If you have any questions, feel free to post your questions now. Just a minute. Where's the page? Okay, I think I'm done with all my pinning and sharing. And okay, so Good evening, everyone, and welcome to Major Havers on Instagram. Longest time. It's been a while I've seen you. Good evening. Welcome. Hope you are fine. We definitely also miss you too. Um, welcome to ATP Live Monday. Thank you so much for joining us on whichever of our platform you're watching from, on Facebook, on YouTube, on Instagram, on our Facebook groups. You are all welcome. So ATP Live Monday is brought to you by Ask the Pediatricians Foundation. This is a platform where you get to ask any questions that you may have about the health of your children, and you will get immediate answers live from a pediatrician straight away. So I'm here with you today for the next 1 hour. And so if you have any question whatsoever about the health of your children, this is a time for you to ask your questions, and then I will try and answer them. So feel free to start dropping your questions now, and we will try and answer them over the next 1 hour. But remember that even if you have any questions after the live section is over, you can still drop your questions and we will try and answer them as well. So welcome everyone. I hope you've had a lovely day. And so feel free to ask any question whatsoever you may have about the health of your children. We will answer them. Let me just check on Instagram. Yeah, Instagram people, you're welcome. And those of us on Facebook, you're welcome as well. And for those who are new, we want to specially welcome you to ATP Ask the Pediatricians Live Monday. ATP Live is a program where you get to ask any questions that you may have about the health of your children, and you will get answers to your question. Ask the Pediatricians, we are committed to the health and the welfare of your children. And we do that both online and offline through all our various platforms. So apart from what we do online, we also do medical outreaches offline, where we go to various communities and we do outreaches. I think we did some Independence Day outreach in Ilaje, Bariga recently. So, and you can see some of the pictures on our Facebook group. And our Facebook group is always open 24/6, Monday to Saturdays, for you to ask questions and you can get answers from professionals. I think that's the difference between us and many other platforms where people can ask questions. But whatever questions you ask on ATP, you can be sure you are getting evidence-based, correct medical advice, and not just opinions of fellow parents as well. So, because we believe that when it comes to health issues, it's not a democracy of opinion, it's about what is right, because life is at stake here. All right, so I think I have my first question on Facebook from Zainab Omolayo. Good evening. Thank you so much for joining us. So your question is, your baby is 11 weeks old and is GCSPD deficient. For those who may not know, GCSPD glucose phosphatase deficiency is the name of an enzyme that we have in our red blood cells. It helps to do some work in the red blood cells. And some people have low levels of these enzymes, can be mild, moderate, or severe deficiency. And so when they are exposed to certain agents, such children or even adults can start to break down their red blood cells, and they can have anemia, they can have jaundice and all that. So what we normally advise is that those who have those kind of conditions, they need to stay away from things that can trigger what we call hemolysis, things that can start making the red cells to break. Okay, and it's quite a long list, ranges from food to medications to different things, really, and so on and so forth. So, before you use anything for your child, you need to check with the list of things that your child can react to. So I'm sure when you were in the hospital, they've given you a list, or you may actually go online, Google it, look through the list of all the possible chemicals, drugs, and food, and then you can now look at them and look at the products that you're using. So I'm not quite sure many of the soap and all that are usually an issue, but definitely drugs, definitely food. There are some of them that you should not use when you have this speed deficiency. But comfort fabric softener, I'm not quite aware, but we obviously it's not always an extensive list. So if you use anything and you notice your child starts to react, then obviously you can avoid them. So that's the most important thing that you have to. We don't have like nobody's a working list of all the possible things a child can react to. It's quite a long list. So I would just recommend for you to do your own research, go online. There are common things like sulfur drugs, things that are drugs. Usually, the drug leaflet will always tell you whether it's something people who have GCPD can react to. I know things like fava beans and something like all this methylatum and all those things that people use. Sometimes you need to avoid them. Menthol, all those kind of things, avoid them. But general soap, I'm not quite sure it's a big deal when it comes to GCPD deficiency. So I'm not quite aware of that. I can't think of any particular product that they will add to soap that will affect GCPD. It's more with things like food and drugs, especially. Those are the ones you really need to watch out for, but not care products like soap and stuff like that. But again, make sure you research that and you can go through it. There may be some support group for GCPD, and some of them may have some of this information. And just for you to be aware that it's not every child that will react to everything. And it also depends on how severe the GCPD in your child is in particular. But I think a good start point is whenever you go to the hospital, always let people know that my child has GCPD deficiency, so that when they are writing drugs, especially, those are the ones that you really need to pay attention to. So I hope that is helpful. Um, all right. Sorry, my light is going on and off. Okay, so I hope that is okay, Zainab. If not, if you're not sure, don't worry so much. You don't need to start be so panicky about using everything. Just use it and see. Most of the time, if the child doesn't react to it, at least then you know you're okay. All right. So if you still have any questions, feel free to drop your questions. I've got about 50 more minutes with us, so feel free to drop any question you may have about the health of your children and we'll try and answer them. I think there's been a recent launch of the measles and rubella vaccine. I think I saw the First Lady of Nigeria launching it recently. Again, this is part of the efforts of the government to deal with certain of these vaccine preventable diseases, because I remember some people were asking us about MMR. So, and I keep telling us that vaccines introduction is always a gradual thing. And so, as at before now, we only have measles vaccine as part of the Nigerian program on immunization. But now we are getting closer to the MMR. So, before, if you want to take MMR rubella vaccine, you have to pay for it, but you can get measles for free. But now the government has introduced the measles rubella vaccine into our immunization schedule. So I think we are making progress. So for those of you who are keen on having the rubella vaccine, it has been launched now. So you can actually go get measles rubella vaccine. I'm not sure whether it's going to be for all children or it's going to be something that we're gradually introducing. But I'm sure we'll be giving you more updates as things begin to unfold. But it has been launched. I just want to introduce to you the fact that we now have the measles and rubella vaccine. I think from what I'm reading here is going to be given to all children 0 to 14. So anyway, just watch out and you can get to your health centers and then you will be able um, to get it as well. Okay. For those who don't know, rubella is what we call German measles. It's a form of it's also one of those viral infections. It doesn't really cause much problem. Rubella itself is socially very self-limiting. I think for rubella, we worry more about the mothers having rubella because if they have rubella, then the baby can have what we call congenital rubella syndrome. And so such babies could be born with deafness, with jaundice, with small head, with problem with the liver, problem with the spleen, and all that. So I think more for pregnant women, we're definitely worried about them. All right, Loretta Moore, thank you so much for joining us. Okay, Loretta Moore says she took the MR vaccine. Oh, amazing. So that means they're giving the women as well. That's amazing. Good. So yes, so for those of us who I think so when we introduce new vaccines, sometimes we give everybody, so it's good. So please get it if you can. All right, got a question by I am Damilola Odunsi. Say my baby is 2 months old and he has cough and catarrh. I don't know what to do. I am really worried. Okay, you don't have to worry, Damilola. Babies, are prone to respiratory infections. And I think at this age, the most common cause usually they are due to viruses. Viruses are most of the people coming to greet you for the baby and all the family members, some of them are coughing, they are sneezing, and they are passing all those germs out. And newborn babies are not as strong in terms of the immunity to fight the infection. But the good news is that most of those viruses, they are self-limiting. They tend to clear by themselves. They don't need specific medications to treat them. So most of the time, they will run their course. Usually within 10 to 14 days, most of them will clear. And I think for you, the most important thing is to prevent future episodes. Okay, so we recommend first that you breastfeed your baby exclusively. One of the benefits of breastfeeding is that you as the mother, you have fought some of these infections before. And oh, okay, it is you. I was surprised when you said I took. Okay, all right, thank you for clarifying that. So it's for the children, not for the mothers. Okay. Most of the well, let me go back to Damila's question. For you as a mother, you must have had some of these infections before, and so you have developed some immune response to them, so you can fight them and as well. So the good news is that when you breastfeed your baby exclusively, you are passing those antibodies to your baby, and that's what will protect you. But this is one of the reasons we recommend exclusive breastfeeding. It helps your baby to fight all these respiratory infections because your baby has not yet developed the antibodies, but you are, as a mother, you are going to give your baby those antibodies through your breast milk, and that will help the baby to fight respiratory infection. Another thing you need to do is to keep babies away from people who are coughing, who are sneezing, especially the siblings. They have gone to school, they come back home coughing, catarrh and all that, they can infect the baby. So you want to keep your baby away from them. You want to encourage people to wash their hands before they carry the baby as much as possible. Let them not just carry the baby, but if they have to, they must wash their hands with soap and water. Avoid taking away to the kitchen where there are fumes. Avoid, your generator. Don't use it close to your room. If you need to fleet the house for, with insecticide, make sure you aerate, you make sure the whole house is well ventilated so that all the smell has gone before you bring the baby back in. These are things you can do. Make sure nobody is smoking around the baby as well. So these are things you can do to protect your baby against respiratory infection. And of course, make sure you go for all the immunizations. So for 6 weeks, we have your penta vaccines and all that. So there are lots of vaccines that work against respiratory infections, including the measles, including the rubella, including all these the pneumococcal vaccine. They also protect our babies against respiratory infections. So I think so. But for now, most cough and catarrh for Damilola, you don't need to give any medication. Most of them will resolve on their own. I hope that's helpful. But you don't have to worry. Just keep breastfeeding your baby and take care of all the things I've told you, and baby will be fine. All right. Sonia, there's a question from Sonia. Yeah, said my son will be 2 on Thursday. I hope that means 2 years old. Okay, he doesn't like to eat. He only weighs 11 kilo, 10.9. Not too bad. Usually, an average 2-year-old will weigh 12 kilos. So 11 kilos, I'm not going to worry about. Okay. He looks very skinny and is going to bother us. It's smart for his age. Number one, his weight is okay. His weight is not yet like malnutrition kind of level. It's just 1 kilo below what is expected for his age. So I'm not going to worry about it. And in terms of the child not eating, some children are just picky eaters. We've had a teaching on picky eaters, how to support picky eaters. So I would recommend you watch those videos, because definitely some children at this age, they just are picky, and there's nothing much you can do about it. But what you can do is just encourage them, give them variety of food, help them to always encourage them to try new food. Don't make it a battle. Don't stress them over it. Don't force feed them. Make sure the food is available. Make sure they can access the food, and make sure you encourage them to just eat. Okay. And instead of making them have large meals, maybe 3 times, 4 times a day, they can eat as many times they want in the day. They can eat frequently, every 2-3 hours. But also don't give them junk alternatives, which is what sometimes mothers do. If you give them alternatives like biscuits and all those pastries and stuff like that, then they're not going to eat normal food. So you have to make sure you're not giving junk. You encourage them to eat normal food, fruit, veggies, but they can eat it as often as they want. And sometimes for the picky eaters, they may have 1 or 2 favorites. It's okay for them if they want to eat that one every day, until you begin to add more to the repertoire of food that they can eat. It's okay for you to allow them to eat whatever they like, even if they have to eat it multiple times a day or every day of their life. It's okay. But more importantly, it's just to encourage them. I will recommend that you watch our video on picky eaters, a whole 60 minutes video, and we went through all the tips, on feeding picky eaters. So I just given you a few of them, but if you want more details, you may want to watch the video as well, and your baby will be fine. So don't worry at all. I'm happy he's so smart. So that's a good thing. All right, Damilola, say thank you, ma. I am breastfeeding exclusively. I'm very happy to hear that. I don't allow anyone to carry him except his dad. Yeah, that's fine. There are many ways baby can get coughs and colds. So just keep doing what you're doing. Keep breastfeeding. Keep baby away. Sometimes you take the baby out as well. It doesn't take maybe 2 hours with people to get colds, because they are really very small. Just one contact is enough. So that's it. Okay, Sonia said, unfortunately, in order for him to eat, I give him junks. No, you don't have to. you have to stop it. And you actually see, that's the thing, you actually, working against your goal. If you want the child to eat and you are giving him junks, then the child is not going to eat the real food. The child is going to want to eat all the junks all the time, which is not good for his health. So what we normally tell parents that children don't starve. Very rarely will children starve. So if a child is not going to eat, you bring out the food for them, they say they're not going to eat it, that's fine. You pack your food and put it back, but you don't give the child something else to eat. You don't give them the junk alternative. Don't worry. I know you are scared. Like, it's not going to die. He's not going to starve to death. Just trust me. Okay. But let the child know that. So what I normally encourage is that you give them, like, let them make like 2 or 3 choices. So you can say you can have an apple or a banana or this. Pick your choice. That, which is why I told you that if they even want to eat what they like multiple times a day, that's fine. If they want to eat the rice 3 times a day, that's fine. It's still okay for the meantime because you are trying to get them to eat. So let them make a choice. Give them at least 2 healthy choices. Let them make a choice of which of the option they want to have. But if they don't eat it, you don't stress over it. You pack the food, put it back in the fridge or in the microwave, and then let it be. You don't have to fight them. Just leave them alone and don't give them something else. Don't give them tea, milk, juice, all those things. You fill their tummy with those things, they're not going to eat. So you just leave them alone. So when they are hungry, they ask for food. Just bring back the same food again. Your lunch that you refused to eat before is still there. Let them eat it. It may take a little bit of tough love and all that, because mothers, we always want quick fix. Sometimes you just have to be patient and do that. So after a while, the child understand that I got to eat and there's no alternative. And make sure you don't have it in the house as well. Not that the child will be able to sneak and get from your cupboard or the fridge. Make sure they are not available. You can have healthy option like fruits. They can be banana, enough, all those ones. You can have those ones on your table. Have it everywhere. Make those ones accessible. But the junk food, you have to get them out and then encourage the child. And make sure the child eats together with the family, which is another thing. Let's eat together. Don't let the child eat as a separate thing, as if it's a punishment for them. Let them see you eat. You're also modeling it. We eat together as a family so that they know that it's okay to eat, and let them eat the same food you're eating. So these are ways to encourage the child, but don't force feed them. Don't make it a battle. You're never going to win a 2-year-old battle. So just take your time and do it like that. But like I said, they can eat as many times as they want during the day. They can eat as many healthy option fruits they want to eat, but no junks. And after a while, they will get used to it. So it's not too late. I know, yeah, you can start to do the right thing now and you get there. So Damilola, don't say, but just know that some children are always going to be picky no matter what you do. If you think you are really struggling, you can go see a dietitian. They can take it up from there. So sometimes dietitian, what they do is that they give you supplements, something the child can drink. Like usually they're healthy supplements, so that the child can get as much calories. That's, we usually do that when children begin to lose weight. I'm not quite sure your child doesn't yet qualify to that stage because his weight is still okay. But usually for children who are really very bad and they're losing weight, then the dietitian will have fortifiers that you can add to the little food they eat, so that even in that small quantity they get a lot of calories. So that's what we normally do for such category of children. Okay, I'm not see the older sister also have cough. Yeah, so most of the time it is the sibling that brings the cough home because they've gone to school, the other children are coughing and they are now coughing. So that's normally what happens. But like I said, usually it will go within 2 weeks. And unfortunately it's difficult to tell the it's difficult to tell the siblings not to get close to the baby. But sometimes you just have to do what you can do. All right, I'm back to Facebook. Seems like I got a couple of questions on Facebook. Blessings, Yama. Good evening, prolific doctor. Wow, I hope so. Can I consume my folic acid, B complex, calcium, while ferrous, while doing exclusive breastfeeding? Yes, you can. The same drugs you were taking, your antenatal vitamins, all those supplements that you were taking when you are pregnant, you can actually take them for breastfeeding as well. And I know some of them will say, "Oh, this is breastfeeding vitamins. This is it's the same thing that's inside. They are just marketing." But if you want to continue taking them, yes, it's actually a good idea. So you can keep taking them for as long as you want. Yes, I understand the routine pregnancy drugs. Yes, you can take them throughout. Okay. Oh, Eunice, somebody from YouTube. Amazing. First, it's been quite a while I get anybody from YouTube. Thank you for watching. Okay, so can a 6-month-old take yogurt and other milk-based fermented drinks? Yes, a 6-month-old can take yogurt, but preferably unsweetened, not the one that you've added too many things to. So it's okay, they can take plain yogurt. Okay, like Nunu, yeah, they can. Just make sure when you say fermented, I really want to be sure it's not the one that you fermented to the alcohol level, because some of these so-called fermented products, then they've developed into alcohol. So, but yogurt level of fermentation, that is okay. But beyond that, you really need to be careful. When we talk about complementary feeding, there's really nothing you can eat that your child cannot eat. But the most important thing, number one, is the texture. So usually when we're introducing new food, we're giving more of porridge, like more of semi-solid, more of mashed, and then gradually we become fully solid. That is number one. Number two, you want to avoid things that the child can choke on, like seeded products and stuff like that. So, or things that are so hard. You remember they cannot chew yet. So you want to make something soft. So some things you have to boil and make soft, or you have to blend and make soft. But otherwise, the real food itself, like the component, like the rice or the yam or whatever, there's nothing a child cannot eat. Even your meat, even your chicken, is that the way you present it will be different for a 6-month-old compared to how you present it to a 2-year-old, to a 4-year-old. So usually at those early phase, it has to be pureed or made into porridge or made very soft that the child can eat. But otherwise, there's nothing that your child cannot eat. I always say that because I get a lot of questions about, can my child eat this? Can my child eat that? Can my child eat? There's virtually nothing your child cannot eat, honestly. The same food you have in your kitchen. It's just that the way you will present it is what is going to be different. So I just want to give like a blanket summary so that mothers always want to ask questions all the time. What can we eat? What can we not eat? The same thing for pregnant women as well. So you just need to have that in mind. And also people also want us to give them a timetable. I actually don't like to do that, because we all have our different kind of staples, what you eat, and the way you prepare your food, so there's no reason why everybody should have the same timetable of food. But the most important thing is for you to understand the principles, and then you can make your own timetable. So the different food classes, the carbohydrate, the energy giving food, the fat and the oil, energy giving. You have the protein, which are the body building foods. You have your minerals and your vitamins, welfare food, and you have your dairy, your milk, and all that. So those are different classes of food, and of course your water. The most important is that you are mixing the food. So we want you trying to have at least 4 of those different classes at every given time they are eating. So we don't want them to just take pap only. We don't want them to just take, a particular class of food, which is what ends to happen. Mother just wants to give pap, 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 and make only. We want the children to have variety, and we want at each meal to have at least 4 different classes of food going in. We want the pap. Let's say, for example, we're doing pap, but it doesn't have to be pap. And I get a lot of questions about, can my baby take pap? Can my baby take, but my baby doesn't want to take pap, and mothers panic about that. Like, there's no constitution, there is no written to the law that the baby has to take pap. The baby never needs to take pap. Baby can decide to take porridge. It can be potato porridge, it can be rice porridge, it can be beans porridge. There are many other things you can give the baby. Baby doesn't have to take pap, but I don't know, because we all grow up with this pap mentality or cereal mentality. It's not necessary, it's not compulsory. So the most important thing that you understand that this is a carbohydrate. We want about 40% of the baby's food to be that. We want the baby to have protein. It could be plant protein, like your granules, like your beans and all that. It could be animal protein, like your egg, your crayfish, your fish, all those things. Then we want baby to have a little bit of the oil, or it could be margarine, it could be oil, palm oil, vegetable oil, a little bit of oil, very small. And of course, you cannot have either the fruits or the veggies, they have another group. And of course, baby can drink the milk. You can add the milk to the pap, baby can drink the milk separately. They don't always also have to eat it all mixed together. They can eat them separately, but just mindful that in each meal, you can have everything. And you can, the other time, if that is a pap one, the other time you can say, okay, let me do porridge. Let's make it, it can be yam porridge, and you've put a little bit of crayfish in it, a little bit of palm oil, a little bit of salt. It's okay for baby's food to have seasonings. The food must have taste, because a lot of mothers also have, oh, can I give sugar? Can I add salt? You also eat food, and if your food doesn't have all those seasonings, you feel like you don't like them. So why do you think the children will like them if you don't put a little bit of seasoning? The most important thing is moderation. Don't overload them. The amount of seasonings, the amount of salt and sugar your children take from other things that you don't think, all those pastries, all those so-called snack that we give our children, it will be unbelievable. They usually have more of those things in them than even the one you cook in your own kitchen. So it's about variety, it's about moderation, it's about making sure all the different things are represented and not just one thing. And then variety, not that child will have to take pap 24/7, because people also ask, so my baby, can I make pap that will put in the cooler for 24/7? So that means you want to give the baby only pap every second, every 3 hours, no, that is not right. Baby should not be taking the pap maybe more than once, then you have other things. So variety, I know it's a lot of stress for mothers if you have to cook food every time, but if you do it, you will actually love it. And then the children get used to eating variety. Then some others will start battling, baby doesn't want to come off bottle. We don't want you to even do complementary feeding with bottles to start with. But people that do all this pap and they're always using the bottle, then when baby is 2 years old, they don't still want to come off the bottle. 3-year-old, they are still taking bottles. It's because of those habits. But if you get it right from the beginning, let baby use the spoon, let them eat variety, let them eat from their plates, let them be playing with food, let them be messing with it. You find that it's easier down the line. So I think I just give a little bit of short set talk on complementary feeding, because obviously it's one of the areas that people tend to ask us lots of questions. Oh, Harriet, sorry, thank you. Harriet is our regional coordinator for Abuja, for the northern part of ATP. Thank you so much for coming online. Thank you. Let me go back to Instagram. I hope nobody's question has gone away. Okay, yeah, okay. Major Evers, welcome. Been a while. So aside from fever, what can make a child falling from bed cause convulsion? Wow, that's a major one. Yeah, the most important, if a child fell and the child has convulsion, that child has head injury. That is the cause. There's nothing else. So a child who is falling from a bed and is not having convulsion has sustained what we call a serious head injury. Okay, it could be the child that bled in the brain or whatever, something has happened to the brain, and that's why the child is convulsing. So please, children should not be falling from the bed at all. When we put our children in the bed, we should always make sure they are guards so that they don't roll over. Let's not put children on the bed, on the couches, and let them not sleep on couches. So it's better you put the child on the floor. Put the child on the mat on the floor. It's better because they can't fall from any height. Once they're on the floor, they can only roll all over the floor. So if you're not going to be there, if your baby bed does not have guards, maybe don't put them on the couch, don't put them on bed and say, I want to quickly. These things happen in seconds. If they happen in seconds, some mothers say, I just want to quickly go and pick, open the door for somebody. I just quickly want to go and pick clothes on the line. These things can happen in seconds. And it's so important because children's brain has still developing. So injuries to the brain, to the developing brain, can be devastating because it can cause lifelong disability. And it's really painful because I've seen children who are completely healthy, completely normal, growing up nicely, and then they fell and they develop head injury, and they will have disability for life. So it is very important that we don't let this happen. And I say this with all sense of responsibility, because I see a lot of mothers don't take it seriously. I see mothers telling me my baby is always falling, it's always hitting the head. We're talking about the brain here. I am a neurodevelopmental pediatrician, so the brain is my field, and it's really important to me that we protect the brain of our babies. So you don't want your baby to end up in my clinic with disability and long-term follow-up with epilepsy and all those things. You need to protect the brain of the baby. The brain is still developing for the first 5 years of life. So any serious injury to that brain can lead to a lifelong disability. So we should not be allowing babies to fall from the bed. We should not allow that to happen, because it has implications that are lifelong, So it is not only convulsion, it's not only fever that causes convulsion. Head injury can cause convulsion as well. And for people who have febrile convulsions, they can have convulsion with any level of fever. The fever doesn't have to be high. So there are people that have convulsion, but in this particular, if it's the same child you are still talking about, you need to be careful whether the fever was before the convulsion or the fever happened after the convulsion. Because when a child is convulsing, they are going to generate heat as well, and they may be warm after the convulsion episode is over. But before so if the child doesn't have fever before the convulsion and the child fell, then that fall is what is causing a convulsion. Unless the child has been sick before, so it's a kind of a chicken and egg situation. So it may be nice to know what is the issue before with the child, but please take the child to the hospital, and that is the job of the doctors, because usually if a child convulses, you didn't tell us the age of this child, we're going to investigate. We need to know why. Especially if there's no fever, and we need to be sure. So maybe we have to scan the brain and all those kind of stuff. So we really always need to know. But I just want to put it that, please, let's make sure we take care of our babies, and we don't allow them to fall or hit their head. Sometimes when I'm seeing those questions, I'm panicking, but the mothers are just like, it's just like, it's no big deal. I mean, she's always falling. I mean, they don't see it as a big deal, but it's a really big deal, because if you've seen children who have disability because of what look like a little fall, then you worry about it. All right, gifted Ifeanyi Mercy. Good evening. Please, can a mother carry a newborn to breastfeed? How can a mother carry a newborn to breastfeed baby of 1 week plus? I'm not quite sure I understand your question, but because the reason why I'm not sure whether I understand your question is that you are asking, how will a mother carry a newborn to breastfeed? How was she breastfeeding the baby for the past 1 week? Because she has to breastfeed the baby. I mean, I'm not quite sure I get the question. So a mother should be able to carry a baby. There is no special way you carry baby in your hands and you put the baby to the breast. If you are talking about how to attach the baby to the breast, we have breastfeeding videos that you can watch. The most important thing is that you make sure that the nipple and the areola, the black part that surround the nipple, they are both in the mouth. Like, when the baby is sucking, you should barely see any black parts of your breast outside. So that is it. So I'm not quite sure. I have a feeling I'm not really getting your question, because they say, how can a mother carry a newborn to breastfeed baby of 1 week plus? I'm not quite sure. So, but I hope if I've answered your question, that's good. But if I've not, maybe you just need to clarify for me what your concerns are, so that I can really address the question properly. Because I have a feeling maybe I'm not quite catching the points you are trying to raise in that post. Okay, Major Heavens is saying the 1 year old, 1 year old woman, he fell and the next day he had fever. So at what point did he convulse? Did he convulse immediately the child fell? Okay, convulsion started after the child is already in the hospital. Okay, that is a different scenario. Okay, because the impression I got from your first post was that the child fell and started to convulse. That's a different thing. but the child fell, and the next day he had fever, and then he was diagnosed of infection. I hope you told them what happened, that this child fell and before the fever, but then you say it's sick like 2 days before the commotion start. For me, see, it depends on what the doctors are finding, really. So I believe the doctors will do the investigation. So, but it's important that if it's a very serious fall, it's important that they exclude the child is not bled in the brain, the child doesn't have any head injury, because the head injury conversion too may not happen straight away. It tends to, but then it should happen within like the first 24 hours, but it's possible it can be delayed. But I would really want to scan the baby's head. If the baby fell and developed convulsions, I really want to scan the brain and make sure there's no bleeding in the brain. And for a 1 year old, at least we can do what we call transfontanel ultrasound scan. If the fontanel is still open a bit, we can do a scan instead of the proper CT scan. But it's important to be sure there's no brain injury, So their fever can cause infection, can cause convulsion, malaria can cause convulsion, a fall can cause convulsion. I think the question in this scenario is that which of them is causing the convulsion, and is it hot, or are they even all three happening? Because sometimes when a child has fever in our setting, we tend to everybody just run after malaria, but sometimes it's not always malaria. So I would expect that they will do blood tests. I would definitely recommend they do a scan of the head of the baby just to be sure, just to be on the safe side. There's nothing like we are missing a child who had bled in the brain. That kind of a thing can be very dangerous. I'm not. That's my own opinion based on what you are telling me. But I have a feeling your doctors may know more information than what you are telling me, because they have seen the child, they have examined the child, and you may have told them more information than you are telling me. But then you should have that conversation with them. And actually, if the child is still very sick, or the child is unconscious, and all this kind of stuff, so have conversation with your doctors. And actually, if the child is also still convulsing and the convulsing has not stopped, I'll also be worried about it. But I hope you are seeing a pediatrician. This kind of a child should be with a pediatrician, not a GP. No disrespect to the general doctors, but there are some conditions that have to be under the care of a pediatrician and not just the general doctors. And I'm sure most doctors will know what they're doing, who have referred this child to a hospital that has a pediatrician there, preferably. Okay, Chifa girl, how are you? Been a while. Have seen you as well. Say good evening. My 3 year, 8 months old is complaining of stomach pain anytime she eats or drinks anything. Okay. I just treated her for malaria and infection. Why are you treating her for malaria and infection? Please don't treat children. I get that post a lot. Mothers just treat children a lot for everything. No, I know we say mothers are the first doctor, but please don't just treat children. You are not supposed to do that. It's abuse of medication. Your child needs to have the diagnosis confirmed. If the child has, who knows whether it's the side effects of the medication you are using that is causing the abdominal pain. I'm not saying that is what is causing it, but it is actually not appropriate to just treat a child just because you feel like treating them. I know we tend to do that a lot before, but now we want to confirm malaria before we treat malaria. We want to confirm the child is ill from infected. It's nothing like infection. The infection must be specific. Is it urinary tract infection? Is it chest infection? Which infection of which area? Because that will also determine what we do. And we should not be using antibiotics without a doctor's prescription. I know our pharmacy sell it to us, but ideally they shouldn't be doing that. So there are many causes of abdominal pain in children. Coming back to your question, actually the commonest cause of abdominal pain in children is what we call constipation. They are not passing stools regularly, so when they are constipated, they will have abdominal pain. So the first question I would like to know is that did your child have abdominal constipation? So that is the first thing you want to be sure. And also you said once the child eats, then is it that you're overfeeding the baby? Because sometimes some of us give too much food to the child, and sometimes their tummy is so full, then they feel like they have pain. Those are the common common stuff that we can easily address. Constipation, we can easily address, not overfeeding. But there are other causes of abdominal pain, like children can have peptic ulcer disease as well, especially if the abdominal pain is associated with food. We tend to get that a lot. So there are two ways. It could either be the food make it worse or the food make it better. you know. So children can have it as well. It could even be other things like urinary tract infection can cause abdominal pain. It could be something more serious like all the surgical kind of condition that can cause abdominal pain. So I would recommend that you see a doctor to evaluate your child. Yeah, I know you did the malaria and food block test. What I think the issue I'm having with your post is you are the one doing it. You are the one. You are not the one to be doing it. It's the job of a doctor. It's our job to determine whether we want to do a blood test, to do a full blood count or malaria. It's not your job. If you have said my doctor did the test or my doctor asked me to do this, I will not have issues with that. But I worry a lot about mothers taking over that job and saying, I'll just go and do malaria test and I'll give my child antibiotics, anti-malaria. It's wrong. You are not supposed to go to the lab and do things on your own. Yes, even if you know, even I know the issue is that because most of the time when you go to the hospital, you always feel like it's only full blood cancer, malaria that my doctor is always asking me to do. So let me not go for consultation. Let me just go and do it on my own. And the lab people will tell you malaria is always positive. And obviously there's always going to be infection. And then you just go to pharmacy and they too will always sell the drugs. You need to understand that most of these people that you are going to, they are businesses and they need to run their business. So they always want to do the drugs. Some of them may even be the ones selling the drugs as well to you as well. So in a country where there are lots of people doing lots of wrong things, I worry so much about it. So please don't treat your children for malaria. Don't treat them for infection. If your child is sick, go to the hospital. Every child must see a doctor first before they have a blood test done, because it is not only malaria and infections that can make children to be sick. And sometimes when we do these treatments in quotes, sometimes we change the picture. The fever may go, others may go, but we've not even addressed the real issue that the child may be having, because a child needs to see a doctor who needs to examine the child first. And that doctor is the one that will decide that I need to have a malaria test done. I want a full blood count done. And it's that doctor that should interpret it and say, yes, there's malaria, and yes, there's infection. And then where is the infection? Because every day, it's not just the white blood cell is high that means infection. There are some conditions that can make the white blood cells to be high without the child having infection. So we need to have all those backgrounds, which is why I worry about parents doing things on their own. Please always go to the hospital. Let's examine the child. Let's be the one to decide, and then let's be the one to tell you what to do. And there are more tests we can do. We can do stool tests. We can do urine tests. Everything is not just full blood cancer, malaria, parasites. There are so many other tests that doctors can do. So, Chief Edgar, I really, really want, is there blood in your baby's stool? Because if there's blood or mucus, we have to be sure there's also no gastroenteritis or infection in the of the digestive system, more or less. So, but I would seriously recommend that you see one of my colleagues. Let them examine that child. Let them touch the tummy of that child, because when we feel the tummy, it can help us. Some children can even have appendicitis, but when you feel the tummy, you can see, oh, there's some tenderness here, there's some swelling here. We can do the abdominal scan. There are so many other things we can do beyond malaria, parasite, and full blood counts, but it's only a doctor that will think of that based on the physical examination of your child. But if you don't give us that opportunity, we may mix things that we should not have mixed, and sometimes it may not be it may not be good for the child. So please see one of my colleagues, let them examine the child. If you're not sure whether the doctor, make sure you see a pediatrician. You can go to general hospital, you can go to teaching hospital, go to hospitals that have pediatricians so that they can do all the needful. And we can now deal with it. So there are so many things that can cause abdominal pain. So it's difficult for us to um to uh to narrow it down without seeing the child first. Okay. All right. Gifted, you've not answered the question I asked you, but you should be breastfeeding your baby. If you don't know how to breastfeed a baby, please go to our Facebook group, go to the guide section, look for the guide on breastfeeding. Please watch all the breastfeeding videos, and then that will address your question. Because I have a feeling you're a first time mom, because some of your questions, I can always locate a first time mom from their questions. I know first time mothers a lot. So what causes a newborn baby to have hiccups? Yes, newborn baby can have hiccups. I don't think it's really important for you to know why, but it's nothing for you to worry about. I think that's just all I'm going to say. It's nothing for you to worry about. It's one of those things babies can have. It's not causing them any harm. It's not causing them any pain to stop on its own. So usually it's just irritation of the diaphragm. The diaphragm is a big muscular wall that separates the what we call the chest, the thoracic cavity from the abdomen. So it separates the chest from the abdomen. And sometimes when babies are finished feeding and all that, there's some pressure on the diaphragm or the nerves around the diaphragm, the phrenic nerve. So they can cause the baby to hiccup. Just leave it alone. He's going to stop. So you don't need to put white cloth on the baby's head. You don't need to feed the baby. You don't need to do nothing. I know mothers always feel like I must do something. Okay, if you want to do something, breastfeed the baby, but hiccups will stop on his own, whether you do anything about it or not. And it is nothing to worry about. I also say it's advisable to bath a baby once a day, even when the navel is not yet healed due to the weather. Yes, you can have your baby have a bath once a day. There's no correlation between the baby having a bath and the weather and the navel healing. There is no link between the three of them. Okay, they are separate events. Okay, so a baby whose navel is not yet drop can have a bath. The most important thing is that you must clean that navel with methylated spirit. Excuse me, if your baby is 1 week plus, you should be using methylated spirit every 4 hours. Every time you change the nappies, every time, at least every 4 hours, you must clean the navel, especially at the base. There shouldn't be all those yellowish cross, whatever. You must clean it and keep it dry. Don't cover it with anything. Don't apply methylated spirit. No, methylatum. Don't apply toothpaste. Don't apply rub or whatever powder, cow dung. Don't apply nothing. Clean it with methylated spirit. Don't cover it with diaper. Don't apply bandage. Don't use hot heat. Don't use cold heat. Don't use nothing. Just clean with methylated spirit. Leave it dry, open to air, and that's all you do until it falls. And even when it has fallen, the cord has dropped, and there's still some raw edges, you keep cleaning until it has fully healed like normal skin. And that doesn't stop you from giving your baby a bath, okay? And that doesn't is respective of the weather. So just make sure that the water is not like ice cold water. Lukewarm water, warm water would do. All right. So we have a resource for first time mothers, first time mom companion. We have those resources. You can get them, and all these questions. I have one on 500 questions for first time mothers. You can also, all these questions were all answered, because first time mothers ask loads of questions, which is okay. But you may want to have a resource to help you with that. So all right. Yeah, okay. Yeah, okay. I think we've answered your question, Major Evers. You're saying the pediatrician good, and she said, "Girl, you." I think I've addressed your question. I think I just want to say, doctor, let them examine the child's tummy. Let them decide what else needs to be done. It may just most of the time there's nothing, and also there may be nothing. Sometimes the abdominal pain there's really nothing. Sometimes some children also use abdominal pain as their getaway card from everything. Maybe they don't want to eat again, so my tummy is paining me. Or sometimes they don't want to go to school, my tummy is paining me. But we just need to be sure first that there is nothing before we start thinking Is there another thing else that the child is trying to tell us and using abdominal pain as a cover? All right. Okay, I think my time is up. But just to let us know that if you still have any questions, we have our Facebook group open 24 hours every Monday to Saturday. Feel free to post your questions there. We now have a dermatologist also helping us with some of the questions for skin issues. So feel free to post it there as well. And I'm sure Dr. Dekaya will be happy to address your questions. So it's not just me, there are many other professionals and our moderators helping us. So, but if your child is very sick, please take sick children to the hospital. There are some things we will not be able to do through social media. We can't lay hands on the child through social media. We can't palpate their tummy. We can set up lines. So if a child is very sick, that child has to go to the hospital. But if you want to ask question, okay, like the first time mom question, why is my baby having hiccups? How often should I breastfeed? Those kind of questions in a healthy child. Feel free to keep those ones coming. But once a child is sick, please, you have to take them to the hospital so that they can see a doctor, so that they can be treated properly. And please try and go for your MR. You say MR now? Is Mrs. Rubella vaccines available? Kudos to the Nigerian government for adding another vaccine to our group of vaccines. So at least, even though we've not gotten to the MMR, but at least we've gotten MR now. So go for the MRV for your children. It will protect them against measles and rubella, which is quite good. Damilola, your baby pull 3 to 4 times a day. That is absolutely normal. The baby can pull up to 12 times a day. In newborn babies, they can do it up to 12 times. As long as the stool is not watery, it's normal stool. We are not worried about that. Thank you so much, Sonia. Thank you, Akinlabi. Do I know this Akinlabi? Okay, thank you, Shifa girl. Thank you, Damilola. Thank you, Major Evans. I'm really impressed that you guys actually stayed throughout as well. Thank you so much for watching, and thank you so much for those on Facebook as well. I'll see you all next week by God's grace. Till then, have a wonderful evening, and it is bye from me. Bye bye.